Coming up on Medically Speaking, bridging hospital and home care for stroke patients, how local law enforcement and volunteers are teaming up to give those struggling with addiction a second chance. Why choosing the right primary care physician could be the single most important step toward better long-term health. How Wilmington's only 24/7 veterinary hospital tackles hip dysplasia with advanced care and compassion. Redefining men's medical care with a game-winning approach to wellness. A powerful conversation for caregivers on caring for seniors with mental health disorders. According to the CDC, in the United States, someone has a stroke every 40 seconds, and every 3.5 minutes, someone dies from one. Strokes are the leading cause of long-term disability and one of the top causes of death in the U.S. Today, we're going to learn about preventative measures and stroke care from Novant Health, New Hanover Regional Medical Center. I'm here with Rebecca Gainey. She's a stroke coordinator at Novant Health Neurosciences Institute. Rebecca, what is a stroke?
So a stroke is a medical emergency. It happens when blood flow to the brain is blocked or slowed down, and this causes that oxygen-rich blood to not be able to reach the cells, so they quickly die.
Why are they so common in our region?
So here in southeastern North Carolina, we live in what's referred to as the stroke belt of the country, and that just means we live in an area that has the highest density, higher than all national averages for strokes. Here at Novant Health New Hanover Regional Medical Center, we treated 1,500 strokes alone just last year.
How would someone know if they're at an increased risk for developing a stroke?
So some of the biggest risk factors that we teach people is high blood pressure, high cholesterol, diabetes, things that we can work on too, like stopping smoking, eating healthier, and having an active lifestyle. And of course, knowing your family history is really important. That plays a big role.
What are some of the signs and symptoms of a stroke?
So we teach an acronym, Be Fast. If you've heard it before, we try and teach everyone in the community, including the schools. And it is an acronym, each thing stands for something. So B is for loss of balance or coordination. E is for a sudden vision change in one eye or both. F is for drooping or uneven smile. And A is for arm weakness or a little bit of numbness that you might have. S is for slurred speech or difficulty communicating and speaking. And T is for time, is time to call 911, because recognizing those symptoms quickly can definitely save a life.
So what should you do if you think you're having a stroke?
So you hear us say time is brain, and every second counts during a stroke because those brain cells do die so quickly. That's why it's critical to call 911 immediately at the first sign of a stroke. That fast action really gives you the best chance at recovery and allows for emergency teams to get to you quickly and start those life-saving treatments.
Novant Health New Hanover Regional Medical Center is considered one of the top in the nation when it comes to stroke care. What is it that you do that's so unique and impactful when it comes to caring for your patients?
So we are a DNB comprehensive stroke center. And what that means is we meet the highest national standards for stroke care, including advanced imaging, specialized stroke teams, and we're able to provide 24/7 treatment capabilities. And we're really proud to be recognized with some of these top awards from the American Heart and American Stroke Associations Get With The Guidelines. They measure us on a monthly basis, and that really shows our commitment to delivering high quality evidence-based care.
Can you share with us something that you're really proud of here at Novant Health?
Yeah, we have so much to be proud of here on the coast, from the IR team and the surgeons that perform our surgeries to the nurses up here on the 5th floor providing excellent stroke care, and the neuro teams that meet you down in the ER to diagnose your stroke. We really have a great team. One of the things that I could point out that we focus on is not just fast treatment, but great treatment. And we really measure these consistently. One of our things that we measure is door to needle time, which is the time that you arrive at our hospital until when you receive that clot busting thrombolytic medication that helps stop the clot. We consistently meet and even beat the national goal because every second really counts. And we don't just stop our care when you leave the hospital after your stroke. We have stroke support groups that you and your loved ones can join, and we do a lot of activities out in the community that really kind of keep you healing and on your journey.
Thank you for sharing all of this valuable information with us. As we wrap up this Medically Speaking, I hope you found this information helpful. Remember, your health journey is uniquely yours. Don't forget to celebrate those milestones along the way. We'll see you next time. In 2024, our nation saw a glimmer of hope. Drug overdose deaths declined by nearly 24%, the steepest drop in years. But behind that progress means more than 87,000 families still lost someone they love to addiction. The battle isn't over, and that's why programs like the Anchor Initiative here in Brunswick County are so vital. They're not just changing statistics, they're changing lives. I'm here with Brunswick County Sheriff Brian Chisholm. Sheriff Chisholm, tell us about the Anchor Initiative. What inspired this program?
This is a life-saving initiative that we started back in 2018. We learned a long time ago here at the Sheriff's Office we cannot arrest away the problem of addiction. We take away all the barriers. We handle the funding, we handle the transportation, and we educate the citizens about the program. We truly want people to get the help that they need and they deserve.
Nowadays, everyone knows someone with an addiction. What is the first step to getting started?
The very first thing they need to do is they need to realize that they need and want help. After that, they can call the Sheriff's Office, they can call 911, they can find a deputy on the street, walk up to them and ask them, and we'll get them the help that they need.
Once someone decides to get help, the first person they're going to talk to is the Anchor coordinator. His name's John. We're going to go meet him now. I'm here with the program coordinator for the Anchor Initiative, John. John, what happens after someone reaches out for help?
So it all starts with a conversation, and we give a general assessment for each individual that calls. We determine if they need detox right away. We determine if inpatient or outpatient would be best for them. And from there, we provide the transportation, we provide the knowledge, because we work with about 12 different facilities in and out of our state, and we provide the funds needed to get these individuals into treatment.
The Anchor Initiative is for any Brunswick County resident struggling with drug or alcohol addiction, but what if that person is incarcerated?
So if an individual is incarcerated, they can also apply for the Anchor Initiative program, but for ones that are unable to get out of our detention center, we also have the Arrow program. And the Arrow program is essentially the same thing as the Anchor. It's just within our detention center. It's a 90-day program that we provide here at the Sheriff's Office.
What impact has this program had since starting in 2018?
So before launching the Anchor Initiative program, we researched several programs across the country, and we assessed the needs of our own community and found that the three biggest barriers that our community had was funding, transportation, and the lack of knowledge. So we provide the funds to get individuals into treatment. We provide the transportation to get individuals back and forth from treatment, and we provide the knowledge for the treatment facility that would best fit that individual. Since then, our program helps about 150 to 200 people a year get into treatment. Those individuals, we vary between 50 to 60 people in treatment at all times. We have about 50 or so graduates each year. We've seen a decrease in overdose-related calls. We've also seen a decrease in property crimes and a strong community bond because of the Anchor Initiative program.
How is this program funded, and how can we as a community support it?
The Anchor Initiative program is funded through 100% donations from the community. Our community support is what keeps this program going. So how you can help is to help spread the word or donate to our program, because any support from the community is a life saved.
Thank you for sharing all this valuable information with us. Now we have a special message for you from your Brunswick County Sheriff, Brian Chisholm.
As your Sheriff of Brunswick County, I'm here to let you know that this program is for you. When you are ready, we will be standing by. Recovery starts with a conversation. We want to help you. We know you can't do it alone. All you have to do is reach out and call us. Thank you.
If you or someone you love is ready for a fresh start, Anchor Initiative is here. Call today or scan the QR code on the screen and take the first step toward recovery. Welcome back to Medically Speaking. In this episode, we'll be discussing why choosing a primary care physician is one of the most important decisions you can make, and why those yearly visits matter more than you think. I'm joined by Dr. Carly Fowler. She's an internal medicine physician and a PCP at Wilmington Health, and she provides personalized and comprehensive health care to adults of all ages. Carly, why is it so important when choosing a primary care physician, and why do those yearly visits matter more than we think?
So choosing a primary care provider is often your first point of contact with the healthcare system. Whether you're seeing your PCP for an acute visit or you end up needing a referral to a specialist, it's very important to have someone that can serve as your quarterback, essentially, in your care. And then the annual visits are very important because it's a time for us to review your overall health, your social history, surgical history, which medications you take, and we can also find ways to catch diseases early before you may develop symptoms.
What types of things do you do at these annual visits?
Yes, so at annual physical exams, we assess the whole body, we do a thorough review of symptoms, we discuss medications, we discuss cancer screenings, vaccinations, and we also help create goals for the year. So we help patients achieve different changes in their lifestyle. and it's just a very important time to review your overall health. We also discuss family history, which can help guide further testing that may need to be performed. And so overall, it's very important to see your doctor every year so they can keep an eye on trends of your health.
Well, a lot of people put these visits off because they feel healthy and they don't think they need them. What would you say to someone who thinks that they really don't need a PCP?
I often hear this, and I would say that being healthy starts with prevention. So staying on top of your health every year, getting your annual blood work done, an annual exam is very important. Often chronic diseases present with signs and symptoms that patients don't always notice themselves to start. So your primary care provider can start to pick up on these signs early and help prevent them from progressing further.
When someone is looking for a primary care physician, what are some things that they should be looking for?
So my first recommendation is for patients to feel comfortable. This is a very important relationship that you ideally maintain for many years. Primary care is intended to be longitudinal. And so I would say comfort is important. I also think it's very important to learn how your primary care provider manages chronic illnesses and also understanding their access to care in case you were to get sick and need an acute visit. It's also important to understand that they are able to see you for that as well.
Well, what would you say as a doctor to someone listening right now or watching this that might not have a PCP and need some encouragement to take that first step?
Absolutely. So I would say it's important to review where various physicians who have new patient availability have trained and maybe their hobbies and interests, and see if it's someone you think you might connect with. And then it's important to call to make that first appointment. I always tell people that the first step is the hardest, which is making the appointment. And from there, usually things go very well.
Well, thank you so much, Dr. Fowler. Choosing a primary care physician is one of the most important decisions you can make, and those annual visits matter more than you think. For more information, you can visit wilmingtonhealth.com. We'll see you next time. Welcome back to Medically Speaking. Hip dysplasia is the most commonly diagnosed orthopedic condition in dogs, and it affects up to 15% of all dogs, sometimes up to 70 to 90% depending on the breed. Dr. Pfeffer is here to join us. He's with Eastern Carolina Veterinary Medical Center. Dr. Pfeffer, let's start with, what is hip dysplasia?
Yeah, so at its core, hip dysplasia is simply a failure of the hip joint to develop properly, okay? And this abnormal development leads to excessive and abnormal motion within the joint itself, and that ultimately leads to cartilage damage and degeneration of the joint, as well as the pain that we consider associated with arthritis. And so animals suffering from hip dysplasia will very often exhibit some very classic clinical signs, and that ranges from a narrow-based stance on their back legs and shifting their weight to their front legs, bunny hopping when they're running, difficulty getting up from a lying or seated position, as well as muscle atrophy, simply limping if one hip is more affected than the other, and then difficulty or a reluctance to rear up on their back legs or climb on and off of furniture, which some people may think is a good thing, but it's actually their dog telling them that they're in pain.
Well, there are some breeds that are more likely to get hip dysplasia than others. Are there any treatment options or things that I can do to prevent hip dysplasia?
Yeah, absolutely. There are several procedures available with the goal of improving the conformation of the hip. So conformation being how that hip fits together. And if we are successful, we can limit that abnormal motion and hopefully prevent degeneration of the hip. The downside is these procedures have to be performed in young, actively growing animals before any degeneration starts, and more often than not, people just don't perceive that their animal is really having a problem, or maybe their animal just isn't affected enough to display clinical signs, and we ultimately miss our window.
So what are the treatment options if my dog is actually experiencing symptoms?
Yeah, first and foremost, for the majority of patients that come to us with hip dysplasia, we are going to try a more conservative approach that is based on multimodal medical management, and that more often than not will involve veterinary-specific nonsteroidal anti-inflammatory drugs, joint supplements, prescription veterinary diets with high levels of omega-3 fatty acids, physical therapy aimed at really kind of beefing up and maintaining the muscle mass around those hip joints, and then probably most importantly, maintaining an appropriate body condition as well as weight to try and limit the excessive load that they're putting on their hips, okay? For animals that are either too painful for a medical management or fail medical management, or even have x-ray changes that are just too bad to attempt medical management, we are going to recommend a surgical procedure. And those two options are a femoral head and neck excision or a total hip replacement. And both have their merits, both have their potential issues, both have their place in our treatment arsenal.
So what exactly is involved when doing a total hip replacement?
Yeah, very similarly to what would happen in a human. Essentially, it is removal of the native ball and socket joint and replacing those with synthetic components, so a synthetic stem, head, and cup. Replacing a hip is no small undertaking. We employ a team of 3 to 4 veterinary technicians whose sole job is to assist the surgeon during the procedure, and that is in addition to our anesthetic team, who have the primary responsibility of making sure the patient is comfortable and obviously stays asleep for their duration. Everyone has a very specific role, and everyone is working together to try and ensure a successful outcome, and that includes our owners, who arguably have the most important job of anyone, because once their pet leaves our facility, they are the sole caretakers, and they are responsible for making sure that they receive appropriate care and that they follow their discharge instructions, because dogs don't read them.
Well, thank you so much. Your reputation certainly precedes you. Eastern Carolina Veterinary Medical Center, still located on Greenville Avenue in Wilmington. Thanks for joining us. We'll see you next time. Welcome back to Medically Speaking. It's important for men to be proactive about their health care. Game Day Men's Health offers cutting-edge options for hormone optimization, medically supervised weight loss, sexual performance, peptides, vitamin wellness, and longevity. Brad, why are men choosing Game Day Men's Health?
Men are choosing Game Day because we're fast. You kind of come in for your appointment. Not only do you not have to wait weeks to get it, but when you come in for your appointment, it's 45 minutes. We're going to draw your blood. We're going to test it in our on-site lab that we have here on campus. Then you're going to sit down with a board-certified clinician and get those results. And that's all completely free. You're not going to pay for any of that, and you're going to leave knowing what your total testosterone is, what your prostate looks like from a blood works perspective, and then what your hemoglobin looks like at the end of that appointment.
Well, tell us, why is hormonal health so important?
Hormonal health is really important because it controls everything. So your hormones, not only testosterone, but all hormones control your mood, how you look, how you feel, how you perform. And then a lot of people are being misdiagnosed with depression and things like that as a result of low testosterone.
Well, tell us also, why are you so passionate about men's health?
I've been on TRT myself for about 6 years now, and it completely changed my life. And now I have the opportunity to be out in town and I meet guys just like me and guys of all ages who are experiencing the same things I was experiencing. And I can now tell them there's a solution and you don't have to feel that way. Whether you're 38 or 58 or 28, there's a solution to get you feeling optimized and a lot better in life.
Yes, you genuinely just want to help other men achieve the total optimization of their health.
Absolutely. I want every guy to feel as good as I feel, and there's a solution out there, and it's Game Day.
All right. Well, let's hear from Russell and see what he has to say. Russell, what makes this leading national men's clinic so unique?
Great question. Game Day Men's Health started in 2018 in Southern California. Proof of concept after 4 or 5 stores later, and 400 strong now today, is the speed and efficiency in which Game Day operates. It's a man cave environment for guys that come in. We test your blood, your TRT, your PSA, and your hemoglobin. We do that right within our lab. Within 15 to 20 minutes, you get your results. You're sitting back with a board-certified clinician, okay? And then you get results the same day as well. So speed and efficiency in a very underserved market for men who do not like going to the doctors.
Yeah, well, you're the largest concierge men's health network in North America, offering free prostate screenings, but that's not all you offer.
Right. Game Day Men's Health is so much more than that. It's really hormone optimization at the end of the day. Sexual performance enhancements, peptides. We have weight loss options, vitamin therapy. We also have musculoskeletal. So there's a lot that Game Day offers in a one-stop kind of shopping for men to come in, come out, go back with their lives, and see somebody. Again, complimentary visits with our board-certified clinicians.
Well, what I love is you're just as passionate about educating your clients, your patients,
Right.
as you are helping them reach total optimization.
Absolutely. We're there for each man on their journey and their families. We have many guys come in and say, gosh, you don't know what you've done for me personally, but for my wife, for my kids. I have energy now. I'm more confident. I'm not depressed. There's the libido functions for men who are looking for that as well. So hormone optimization is so important for each and every man. It's like driving your car with a couple missing spark plugs. Nobody wants to do that.
Russell, you're so passionate about helping our local men achieve total health optimization that you have a special offer just for our viewers. Do you want to tell us about it?
Yes, Fox Wilmington viewers, men, come on into game day today. Schedule an appointment, free consultation, free blood work, and you'll get 1 free month of TRT. Pay for 1, get 1 month free. Just mention Fox Wilmington.
That's right. Tell them Fox Wilmington sent you. Game Day Men's Health, they're here to help you prioritize your health and feel better. Welcome back to Medically Speaking. I'm here with Peggy Bedour, and she is the owner of a company called LifeSource. Peggy, I'm excited to learn more about this company. Tell us about it.
Thank you so much, Christina, for having us. So LifeSource, I started it about 16 years ago, and I did it because I love the population we serve. You know, someone's got to take care of our elderly patients, and we're all going to get there one day, hopefully. And so someone's got to do that. But also, I love mental health. It's my favorite specialty. I love the people who choose mental health as their profession. And I've, seen it in my life, and I've been close to it, and I understand what it does to folks. And so, I just feel like it was a good calling for me. We are now in 500 facilities. We serve 8 states. We provide not just mental health services, but also primary care services for over 15,000 patients. These angels who take care of patients in these facilities, they are wonderful and they do so many things, but they do not understand how to take care of the mental health patient. They just haven't been trained. And so we decided as a company that, we're the experts, we should go on site and we should train these people, these wonderful, wonderful folks. And so we do. We go on site, we have a whole curriculum of courses that we can teach. We do it for free. We even offer free CEUs to these folks. The problem has been that not all of them have taken us up on it. They get busy and they just don't have time to do it. So we have written a book. It's called LifeSource, and what we did is we gathered the cream of the crop of clinicians, and we said, okay, you're going to write a chapter on this diagnosis because you specialize in that. You're going to write a chapter on this diagnosis because that's your specialty area. And so we have a whole book of people who have done that. And I said, listen, it has to be informational, it has to be educational, it has to be for the lay person, not the clinician, and it has to be entertaining. We also have put together a training course, an online training course that's based on the book. So the management in these facilities can know who's taken the training, who hasn't taken the training. But then in the middle of all of that, we realized, oh my gosh, this isn't just for long-term care or senior living. This can be for any caregiver around the world. There are millions of them. And people who are taking care of patients with dementia, Alzheimer's, anxiety, depression, all kinds of things. And imagine how difficult it is to be a caregiver and for a patient like that and not really understand the disease and not understand what is causing them to react the way they are. And so our hope for the book is that it will just become a guide for caregivers to allow them to be the best caregiver that they can possibly be, but also relieve their stress. I just can't imagine how difficult it is to take care of someone and not know how. So that's the LifeSource book.
Well, Peggy, thank you so much. Let's hear from your co-author, Chuck Whitlock. Chuck, what do you want the audience to know about your book, LifeSource?
I wish I had 10 hours to tell you, Christina. This is the most significant book I've ever worked on in my life, and let me tell you why. Let's assume that your husband is diagnosed with a mental disorder, Alzheimer's. All you have to do is go to the LifeSource book, and in that book, leading psychiatrists and psychologists and practitioners in the mental health field all tell their stories with real life stories about what works and what doesn't work. You could go to our index, which doesn't exist in a lot of books, and you can look up Alzheimer's, and it will tell you, go to page 62. That's what the psychiatrist says about it. Go to page 127. That's what the psychologist says you should do if given some kind of an emergency situation. Real life stories are in this book, real resources. It's all in the book. Even robotics and AI information about long-term care is in the LifeSource books.
Well, I can't let you leave here without telling us how we get a copy of this book.
Well, there's several ways that you can do it. In Wilmington, you go to Barnes & Noble. If you're anywhere outside of Wilmington, I want you to go to lifesourceshop.com. Lifesourceshop.com. and get a book and get it now. I'm telling you, it will change your life if you're a caregiver.
All right, run, don't walk, get your copy of LifeSource today. Thanks for joining us. That's it for this edition of Medically Speaking. You can watch any of these segments and get more information anytime on foxwilmington.com. We'll see you next time.
What does it mean to offer true care? It means providing expert care at the best value. That's true care. From Wilmington Health, visit wilmingtonhealth.com to learn more.
The Brunswick County Sheriff's Office is looking for the best and brightest, those who have integrity and sense of commitment to help our community and make a difference. Join us.
I'm Brian Chisholm, Brunswick County Sheriff. We would love for you to be a part of our Brunswick County Sheriff's Office family.
When your pet faces an emergency, every second matters. Eastern Carolina Veterinary Medical Center is still here for you 24 hours a day, 7 days a week. Compassionate care, always here when you need us most.
I want experts on my team. I want the most advanced treatments. I want to feel like myself again.
For nationally recognized neurological care, you want Novant.
Hey guys, it's Christine. I'm here at Game Day Men's Health. This is Brad and Russell, and they have a special offer just for you.
Fox viewers, come into Game Day Men's Health and say Fox Wilmington for 1 free month of TRT. Buy one, get one free.
Caregiving for a person with a mental disorder can be a full-time job. Former First Lady Rosalind Carter said there are only 4 types of people: those who have been caregivers, those who are caregivers, those who will be caregivers, and those who need caregivers. If you are a caregiver for someone with a mental illness, know someone who is a caregiver, or think you'll need to care for a person with a mental illness, pick up your copy of LifeSource at Wilmington's Barnes & Noble or go to lifesourceshop.com.
I thought he was dying. I thought he was completely crazy. I had never heard the word delirium.
Seniors who have Alzheimer's, depression, behavioral problems, PTSD, and other mental health disorders can require around-the-clock care. If you are a caregiver, you need the advice in LifeSource, written for caregivers by psychiatrists, psychologists, mental health practitioners, and university professors. Buy your copy at the Wilmington Barnes & Noble or go to lifesourceshop.com.